Hey, thank you all. Hey, thanks so much for being here today. We've got some big news for you, we think. I'm so excited. Excited to be standing here at Community Hospital East and talk about all the things we've got going forward. We've got a wonderful set of people to share some remarks today, but we also have some other people in the audience. I see members of our network board, members of our foundation board, members of our medical staff, longtime employees of the organization, even the one and only Anita Harden. The lady who never ages. So thank you. Thanks for being here, Anita. At one point, I was younger than you, but I don't know what happened. In addition, Senator Pat Miller is here. Pat, I saw you somewhere. Thank you so much for coming on short notice. Representative Dan Forrestal is right here. Thank you so much as well. Deputy Mayor Adam Collins. I thought I saw. Adam, thank you. And then a number of other people here. Frank Hancock's the chairman of our foundation board. Thanks for coming, Frank. Pat McRoy, foundation. He's our fundraising volunteer. Tim Wright, a foundation board member. Gary Leto. Gary, thank you all so much. Bob Shea is part of our foundation fundraising efforts. Bill Sigmund, longtime board member. And then also Ben White, who's the president of the Community Heights Neighborhood Association. So thanks to those people and thanks to everybody else for coming out here this afternoon. Really, really appreciate it. It's my pleasure to tell you that Community Hospital East, we're here. We're here to stay and we're here for good. Almost 58 years ago to the day, almost within a couple weeks, this place opened. It opened to serve the citizens of the east side of Indianapolis and to say we're here with the responsibility for the health and well-being of the east side community. That's all we were at the time. And I'm delighted to say 58 years later, we're here to again establish the fact that this is our responsibility and we have every intention of taking care of the citizens' health needs on the east side of Indianapolis, and we're going to do that. Somebody might say, well, what the heck took you so long, Brian? And that's a fair question, because we've been doing all kinds of analysis, and I get a lot of messages from people in the organization that you're doing this at North and this at South, as we try to prepare all of our regions and all of our communities for the healthcare of the future. And if you think about it, the last 5 years, we've made a lot of investments on the east side. We've added health pavilions and med checks and helped start a Jane Pauley Community Health Center, and that's expanded to a lot of places, and our family practice residency has expanded. We've tried to do all these things to say what's going to happen with healthcare, and no matter what we've done, the services at this facility continue to increase. Our emergency room, those who work there understand that that's going on. And the demand for this campus, when we first did our work 7 years ago, we said that this campus only needed to be a 100-bed hospital. Fortunately, we didn't do something then because we wouldn't fit. So bottom line is, we're here for good. We're going to make an investment, and what we're going to talk about today is the fact that we're going to invest $175 million into this campus, and more importantly, this region. Because everybody doesn't need to come to this campus. Matter of fact, we hope that a lot of people don't. We won't be adding beds. Okay, this is not a bed expansion. We will be adding a number of ways for people can expand to this site, and Scott Tiefteller is going to tell you all about that. But I'm so excited because the enthusiasm that's here is so apparent that on 24 hours notice, people would show up because something's happening at the East. You know what? And the East Side community long needs this. We're committed and hold us to that responsibility. We're going to work with every one of you all to make sure we deliver on that promise. It's my pleasure to introduce Scott Tiefteller, President of our East Region.
Thanks, Brian. Well, this is a team effort, so let's start there. So I appreciate Brian, and we'll talk a little later about some people, but I want to talk to you about what we're going to do. This is more than just our hospital plan. It's a whole lot more. We'll begin with planning here on the hospital on this location, really redesign about what it needs to look like to care for our patients for the future. One of the first things we're going to be doing, which I think a lot of people are going to really enjoy this, we're going to expand our emergency room. Since 2002, we have seen a 62% increase in our emergency room. So we're going to go from having 35 rooms to 64 rooms. So why would we do that? What we're going to do is create a better experience for our patients and their families. We're going to allow us to better serve an ever-growing need that just continues to grow. We're also going to be adding 17,000 square feet to the front. We have a 2 ambulance bay today. We're going to knock that down and create a 3 ambulance bay, much more efficient so that we can get patients in quickly, get them treated, and get them home back to where they belong in their families. So you'll see some changes on the exterior as well. We're also going to make improvements throughout the hospital. We're going to modernize the appearance. I mean, it's a great facility. It's been here since the 1950s, and now it's time to look like the centuries we're heading into, so that's fantastic. We're going to be refreshing our patient rooms. We're just going to make the entire flow for our patients. It's about the patient experience. It's about how do we create an experience where the patient says, if I need care, that's the place I want to go. This is what this East Side facility and hospital is about, is take care of people on the East Side. Our goal is to build improvements around the patients, as I said, the families and the guests as well. But that's only part of our plan. We service, and we'll show you in a few moments, 250,000 people are serviced in the East Side in our geographic location that, as Brian said, we're here to serve that population. So we're going to do that not only through the hospital, but we're going to be building 3 new ambulatory pavilions. Brian said we've already built 2. We're going to be building 3 more. So why are we doing that? It's about getting out, pressing our 4 walls outside of here. Let's get to our patients where they need the care, the right place, at the right time, and that's not necessarily inside the hospital. So it's important for you to understand that we're thinking differently than we did 50 years ago, because healthcare could be much more ambulatory than it is today. So we're thinking in the future. Also, one of our pavilions that we're going to talk about is we're building one in Beech Grove. That's the reason we have Mayor Buckley. He's going to talk about that in a few minutes, about what that means to his community and how we serve that community as well. A lot more of this information is going to be forthcoming in some releases that will give you much more detail, but a high level I want you to walk away with that you know that we care for our citizens on the East Side. We're making a major investment that we've been here for 50 years. We want to be here for the next 50 years. And in a different format to provide the right kind of care, the right place at the right time. So like Brian said, thank you all so much for coming out. This is exciting news for our East Side. And I'm excited to get started. So we'll talk let you have a chance to answer questions a little bit later.
Thanks, Scott. Scott's accomplished a lot in his first 10 months on the job down here, so what took you so long, Anita? It is truly my pleasure to introduce our Mayor, Greg Ballard. When he said he could be here today, I was truly honored and humbled by the fact that he would take time out of his busy schedule to come be with us. He has been a fabulous partner. He has been somebody who has been really, really interested in what we're doing here. He was out here recently for one of his town hall meetings. If you came down to Emerson, you see all the fabulous work going on there to make this a better gateway to this facility. And we just appreciate the partnership that we have with the city of Indianapolis, and especially with Mayor Greg Ballard.
Well, I wasn't expecting this many people for the announcement. So right now I'm kind of worried about the quality of the patient care in the hospital. I don't know what's going on, but I hope it's okay with everybody. It is a great day for community health, obviously, but for the east side of Indianapolis too, and which is very important to me. As you know, we've done a lot of work on the east side of Indianapolis over the last few years. I think that's been obvious. You saw the Legacy Project and how that all moves out here, and you see the work on Emerson and so much that's going on. And every area really needs a good healthcare system right there. And Community East has been doing that for a long time, and now you're hearing that they're going to expand even further into the neighborhoods, into different places, and which is important because this area obviously is getting a lot of investment and is really going through a resurgence right now, which is tremendous. $175 million is nothing to sneeze at either. That's a fair chunk of change. So it's about the expanded service to the neighborhoods that really need that quality of care. And so this will have a great impact on the patients in the area and really impact their lives on a daily basis. And so it will increase the quality of the neighborhoods, clearly. People will look at this as a place. People always look at certain things when they move into neighborhoods, and healthcare is one of those things. And as community continues to expand here on the east side of Indianapolis, then people are going to say, well, my healthcare needs could be met on the east side of Indianapolis, and I think that's very, very important. So we want to continue to build up these areas. You know, we are getting a lot of attention in the city for a lot of on a national level, and that's all good. But it is important that we recognize that it's the people in the city that are really important to us, and people are moving into the city at the rate that we haven't seen in a long time. From 2010 to 2013, they moved into the rate at the rate double the previous decade. And in 2013 alone, we had 9,000 people move into the city, which is, we haven't had that sort of increase since 1992. So something is clearly happening, and it will continue to grow, and I'd like to think we're being innovative in the city, and a lot of good things are happening, and you saw an announcement yesterday with the EBRT, and you know about Blue Windy, and you know all those other things. But this ultimately comes down to healthcare and taking care of the neighborhoods. I think as most of the community people know, this is my hospital, all right? I don't know how many times I've been in this hospital. Most of it was not for me, just to be fair, okay? But when I've needed to come over on an emergency basis, they've been really good to me and kind of sneak me in the back door, so nobody knows I'm really here. But I've done that a couple times. But what's more meaningful to me is they took care of my dad here for so long, and who was not of good health most of his adult life. And I can't tell you how many times I came home on leave from the Marine Corps to come right to this hospital to see my dad, because it was very frequent. And I actually, it'd be tough to say this one. I actually told my dad I'm joining the Marine Corps when he was in a hospital bed here in Community East. And he didn't take that very well. He didn't take that very well. I mean, but I think he knew his younger son was moving on at that point in time. So, so this place has a lot of memories for me, and so that's why it's always good to come out here, because this particular building has meant so much to my family. Thank you so much for all of you, for all that you do. You're a tremendous organization. I appreciate it so much.
Thank you, Mayor. We appreciate that, and thank you for your service as well. Now it's my pleasure to welcome Michael Hubner. He's the President and CEO of the Indiana Chamber.
Thank you, Scott. I'll be brief. Always hard to follow the mayor. I worked for him for 5 years, and that still doesn't change. You know, working for the mayor as I did, you know, there's a mantra that the staff really follows, and that's always look 10 to 50 years out. And so as you look at a massive investment like this of $175 million and how that's going to affect our city 10 to 50 years out, it's not just about the jobs, the good jobs that it's going to create as community health invests that money here. You know, the nature of economic development is changing so much, and that's something that we think about at the Chamber of Commerce. We have 2,500 businesses as members, but we're also an economic development organization. And one of the biggest changes impacting cities, and this, you know, economic development term that we use, is it's not just about being a business-friendly city. It's about providing a high quality of life for your residents. And also, you know, this boom of millennial workers, and you know, many of you are millennials, and if not, they're your sons and daughters and nieces and nephews. They're a little different from, you know, people in my, like Gen Xers like me and the baby boom generation. You know, they value access to health and wellness facilities. They value things like sustainability, which is why the mayor and Senator Miller and Representative Forstall have been great leaders on issues like mass transit and things like that. So as we think 10 to 50 years out, the great thing about this investment today is that gives me, as a Chamber of Commerce president, just another reason to say to somebody moving here from California or New York, saying, you got to check out Community Heights, you need to check out Little Flower, you need to check out Irvington. Sorry if I didn't mention your neighborhood. I know East Side residents are very passionate, but you need to. it's another reason. It's another reason you need to go look at these neighborhoods, because you can have access to good jobs, access to downtown, and access to really high quality health and wellness facilities. And that's something that's really important as we think about the future of this area 10 to 50 years out. So we couldn't be more excited as the Chamber of Commerce. It's going to give us another reason to drive people and investment to the Near East Side. Just want to thank Brian for his leadership and community health for making this massive investment today. So thank you.
Thanks, Michael. And I'm glad you mentioned all the neighborhoods around us. So if you have any questions, talk to Michael. As I said earlier, we are going to build 3 new health pavilions. But one that we're going to build first is going to be the one in Beech Grove. And so I'd like Dennis Buckley, the mayor of Beech Grove, to come share a few words, if you would, please.
Well, good morning, everybody, and it's a blessing for me to be here today. I started my relationship with Community Health Network about 5 years ago. I had just retired as chief, got sick, and they saved my life, and I'm standing here today as a result of that. So I decided that I was going to run for mayor of Beech Grove, and I did. My wife thought I was nuts, and she still does today. But anyway, I started meeting with several of the folks here at Community Health, and now it's like homecoming week for me, because a lot of the people I've dealt with for the past 5 years are sitting here today. So it's a pleasure to see all of you, but I will not call the Heart Center Community Vascular and Heart. I will always refer it to the Indiana Heart Hospital, because that's where I went. And Mayor Ballard walked in here. I came in Community Health Network on a stretcher. So Brian and I have talked on several occasions, Dr. Ledyard, about bringing health care to the city of Beech Grove, for the simple reason that people need to have an option. People need, when they're ill or sick, they need to go somewhere. And we need to provide that to them. I didn't want anything else. All I wanted for the people of Beech Grove was to be able to go somewhere and get help. That's what this is all about, and this is what this will always be about. So I'm delighted to be part of this exciting announcement. As mayor of the city of Beech Grove, my highest priority is ensuring the well-being of my city, its safety, and its citizens. That includes both physical health and economic stability. Today's announcement is about both of those things. The proposal to build a community health pavilion in our city of Beech Grove is a welcome economic boost, as it always is when a business makes plans to open doors within our city. Such news means added jobs and a dose of economic vitality that we expect to be contagious. We in the city of Beech Grove also welcome the increased access to health care that this proposal represents. It's important to any city to have convenient retail shops, restaurants, parks, schools, and services of all kinds. But few things are more important than convenient health care services. Good health, and I am an example, after all, is the key to enjoying all other aspects of life in the city of Beech Grove. We're grateful that Community Health Network is making better health easier to achieve in the city of Beech Grove, and we are blessed to have you join us in our city. Thank you so much.
Thanks, Dennis. Boy, these are a lot of hard acts to follow. But I can't think of a better person that can follow that work. It is truly my pleasure to share this podium with Dr. Don Zipperman. Dr. Zipperman is a cardiologist, and he serves us here on the East Side. He's our president of clinical performance and vice president of medical affairs. He'll put this initiative into context from a physician's perspective. Don is truly an advocate for the East Side and for the citizens of the East Side and all that he does. And Don, please come share a few words, and thank you for being part of us.
Thank you for the introduction. Sort of hard to follow up with that, I'm afraid. As Scott said, I've been here on the East Side for a long time. I started here in 1981. One of the passions has been keeping this hospital moving forward and going forward. And I think this will help us with that. We have needed a change in the emergency department for a long time, an expansion for a long time. And when we started looking at this project, we realized that it wasn't just about the emergency department. It really was about what we could do to provide better care for the patients here in East, and what we could do to provide care for the patients within the region at East. So in addition to modernizing the ED, as Scott and everyone else has said, we're looking outside our walls. We're looking to try to provide care for people where they are, where they live, where they work, where they are at this point in time. This hospital was built by the people of the East Side. The original monies were collected. People went door to door to bring the monies here to collect. In fact, I remember seeing a picture of a bank vault with a stack of bills just before the hospital ground was broken. Fortunately, I was not here then. I remember seeing the picture. Some people accuse me of being here for that long. Community East opened in 1956. As I said, people on the East Side want to get care close to home. They don't want to have to travel. I can't tell you how many patients say, really, I've got to go to Castleton, I've got to go to the Heart Hospital. They want to be here on the East Side for their care. And with this, we are reaffirming our commitment to where community began, here at Community East. We want to make it easier for the patients and our neighbors to access care by building the pavilions, by having pavilions in their neighborhoods in Beech Grove and in the other neighborhoods here on the East Side. But it's not just making care convenient and easy to access. We want to make it more effective as well. One of the problems, obviously, is chronic health problems. We see so many people with heart failure, with chronic obstructive pulmonary disease, with hypertension, with coronary artery disease, which has been poorly treated, either because they haven't had access to physicians, or they haven't taken advantage of the access that they have. And we hope that we can help bring that care to patients where they are, closer to home. We want to address this effectively. We want to help prevent disease, because obviously if we can keep them healthy, they can continue working, they can have a better life and a longer life. And we hope that by providing a primary care setting in the pavilions that we can accomplish this. Really and truly, the thrust of medicine has changed over the years. It is not as much taking care of sick patients. That does happen. We all do that acutely and chronically. But it's about providing information to the patients so they could be healthy and have a healthy lifestyle. And that's really what we want. We want our neighbors to be healthy. And that's why we're doing what we're doing. Thank you.
Thanks, Don. You know, I'd be remorse if I did acknowledge a few people, so let me have a little bit of liberty. My team that has worked so diligently, and they are really the backbone to make this thing happen. And managers and the directors that take great care of our patients every day, thank you for what you do. But I do want to recognize Dr. Robin Ledger, Paige Dooley, Julie Ertl, Mark Raker, Dan Hodgkins, and Jason Landis. This team has worked countless hours to bring this to fruition. Just so I don't get in a lot of trouble, Brian just said I might want to recognize my wife, who's out there somewhere. So she is my backbone that keeps me going. So, honey, I know I'm in trouble. I'll pay for that later. This is truly an exciting day for us here at Community. We're so pleased to send this message. This is the area that gave this facility birth 60 years ago. So here's the message. We are committed to the east side of Indianapolis. We're here where it all began, and we are here where you need us to be. and we are here for good. So, with all that being said, thank you all so much for coming out today. This is truly an historic moment. And there's a lot of people, and I know Brian has acknowledged everybody, and hopefully we didn't forget somebody. If we did, we apologize. And I know I'm going to be in trouble for the last statement, but before we adjourn, I've been told I have to do this. Are there any questions you would like to ask us? I'm sure. Okay. Again, thank you so much. We're excited. Oh.
Where in Beech Grove is the pavilion going to be located?
We're working with Mayor Buckley to make that determination of what is the best location. So once again, like Mayor Buckley said, we want to find the right location that's going to meet the most of your citizens. So we'll be working with them to identify that location. Thank you for your questions. Have a great day.